Eating disorders have been talked about in the mainstream media more and more in recent years, but there are a lot of myths and misconceptions about what is an eating disorder, what does an eating disorder look like, and how does it impact people. So in order for us to be better allies to people suffering from eating disorders, we're going to spend this video debunking some of the most common myths about eating disorders. By watching this video, you'll be better informed about eating disorders so you can be a better support for those in your life who are experiencing an eating disorder. With more information, you'll be able to be more empathic and a better support. Mackenzie of Parallel Wellness, and on this channel we explore topics that bring clients to our therapy practice every day. You'll find tips and strategies that you can make your own to enhance your everyday life and manage your mental wellness. So subscribe to our channel and hit the bell in the corner so you're notified when we post new videos. We publish every Wednesday. Most of what people know about eating disorders actually comes from the mainstream media or, common conversations that people have about eating disorders. Now, the problem with this is that the mainstream media tends to use extreme examples of eating disorders to, describe what's happening. Unfortunately, this is not representative of all experiences. And so that's why it's really important to have a look at what are some of these myths and misconceptions that we have and what is really true. The first myth that often comes up is that in order to have an eating disorder, you must look skeletal, that you must look incredibly thin, or that having an eating disorder is all about weight. And this cannot be further from the truth. First of all, eating disorders are an entire range of disorders, and in some situations, people, yes, they do become incredibly thin. But in other situations, people actually gain weight when they have an eating disorder. And the weight that somebody is actually does not dictate in any way the amount of psychological or emotional or even physical suffering that they're going through or how extreme their eating disorder is. It's just one minor factor. So regardless of somebody's weight, it does not determine what type of eating disorder they have or how badly they are suffering or how much their eating disorder is impacting their lives. Weight is often a secondary factor that occurs with an eating disorder. So there's so much going on beneath the surface, psychologically, physically, and emotionally, and weight is just one part of that. But really, eating disorders consist of so much more than just weight. Related to this, and this often comes up with clients, and I think it's a true symptom of this ridiculous belief that our society has that weight and, looking incredibly thin is what an eating disorder is. But it's not uncommon for clients to come in very concerned that if they don't look like they're, a skeleton or they're not incredibly thin, that somehow, negates what they're experiencing and that they don't really need help or that they're not as bad off as somebody else might be. And that could not be further from the truth. And I really, if anybody's watching this who has an eating disorder and is really hesitating on whether or not they want to, seek any treatment for their eating disorder, please know that your weight has nothing to do with this. Yes, it is a factor, but there's so much more to this. And so I really don't want that to discourage anybody from seeking help that they could really benefit from. And a caveat to this as well is that weight actually has nothing to do with eating disorders because people come in all shapes and sizes, including weight, and that does not determine whether or not somebody that could be very healthy has an eating disorder. People come in all different shapes and sizes, and it's not possible to stand two people beside each other and tell whether or not one or the other has an eating disorder because it's just, you cannot see that from the outside. So if someone is thin, that does not mean that they have an eating disorder. Making comments or making jokes about somebody, not eating a whole lot, or if they are thinner than the average person, making jokes that they have an eating disorder is not funny. It's actually cruel, and it increases the stigma and this idea that people must be thin in order to have an eating disorder. And it affects people on both sides, both people that are healthy but very thin and struggling with their weight for different reasons, and people with eating disorders. So if we can just stop these conversations, that would be a good idea. Another myth that I often hear is that people choose to have an eating disorder. Now, people may not outright say that, but what this looks like is people saying, well, just eat. It's not that hard. Like, just take the bite and you'll be getting better. But it's not that easy. Eating disorders are incredibly distressing for the person that's experiencing them. Not only does it impact their internal world and what's going on for them on a daily basis and really infiltrate every aspect of their lives, but it also impacts their relationships with other people, their ability to engage with work and school and the world around them. If that was a choice, nobody would choose that. And not having an eating disorder or recovering is not as simple as just starting to eat. Research has shown that having an eating disorder, yes, it's about the behavioral things like making sure you're getting enough food, or that you're abstaining from binge eating or over exercising or any kind of compensatory behaviors. But there's also an emotional level of things and a psychological level of things. When somebody is in recovery, yes, they do start making quite a few behavioral changes in order to overcome their eating disorder. But just because they're starting to eat again or they're eating in a more normalized pattern does not mean that they're not still very impacted by that eating disorder. That means that they're really struggling on a daily basis in order to make these behavioral changes, despite many things on the inside remaining the same. Recovery is a process, so it's very normal for people to have really great days and then have times where they slip up. And so if we were to expect that people were going to overcome their eating disorder by just eating or by making a choice to get better, that would just be so unfair to them, because it's very, very, very normal that you're going to have ups and downs. I don't think there's a person out there who has not had good days and bad days and slip-ups. So if you are a loved one or you know somebody who has an eating disorder, please let me tell you that blaming them or shaming them into not having an eating disorder does not work. If anything, it does the complete opposite. First, they're going to build walls up to keep you in and keep themselves safe, and they're going to then end up being challenged by it and probably triggered very much by the comments that anybody is making about their eating habits or exercise habits, and it's not going to help. Now, another misconception that I often hear is that people who have everything going for them should not be impacted by eating disorders. These people might on the outside look like they've got school going well, friends going well, they've got a great personality. Nothing seems to be really negative going on in their lives. And so it seems really unfathomable to the people around them that they would then have this thing that's just severely impacting their lives in a negative way. And so often people around them are shocked that they have an eating disorder. Now, the challenge with this one, though, is that the way other people see you is not necessarily how you see or believe about yourself. You know, people that are very high achievers or set high expectations for themselves actually are more susceptible to developing an eating disorder. And the reason for that is that, you know, you've got these expectations and you've probably got great evidence that if you try really hard at something, you will achieve. And people with eating disorders tend to be incredibly hard on themselves. This is a complete misconception that because people with eating disorders tend to have a lot going well for themselves, that they should not possibly have an eating disorder is just not true. Now, a huge misconception that people have about eating disorders is that it's about weight or food. And I kind of alluded to this before. People seem to think that eating disorders are about not wanting to eat much food or overeating or trying to, you know, achieve a specific weight and shape. And sure, there's that part of it. There's, you know, aspects of that to eating disorders, but it's not about vanity. There's so much more to eating disorders. Eating disorders have layers and layers and layers and layers to them. And so in previous videos, I've talked about the iceberg where, you know, there's only so much that we're seeing above the surface. And those are those eating disorder behaviors that are really challenging and problematic. However, there's so much below the surface that's really going on for people with eating disorders. So it's not really about food and weight. That's just a part of it. It's about so much more that's beneath the surface. So stay tuned for that video because I'd really like to cover that. Another, unfortunately, common misconception is that somehow blaming and shaming somebody will force them out of their eating disorder. And this could not be further from the truth. If anything, it just makes things worse. And to have some compassion for the people that do go about this tactic, I think there's a lot of fear that they're dealing with, and they really just want their loved one to be better and not to be sick and not to be in danger. However, what this ends up looking like is, if you're not going to eat, I'm not going to eat, or why are you doing this to us when we're trying to have a nice night and we would like to go out together? You're ruining the event, you're ruining it for other people. And I think that, you know, maybe that comes from a good place, but it actually does quite a lot of damage to the person who is experiencing the eating disorder. Again, anytime you blame or shame somebody for their behaviors, if anything, it's just going to build walls up between the two of you, prevent them from sharing, and really actually adds to, when I talk about the iceberg, adds to their experience of what's going on beneath the surface. This person does not want to have an eating disorder. They don't want to be engaging in these issues. They don't want to be, you know, challenging or making trouble for anybody. And this is a really hard thing for them to hear. And the final misconception that I'm going to talk about, and I know I have not covered all of the misconceptions that exist about eating disorders, but one that often comes up is that eating disorders are rare. which in fact they are not rare. For one, we live in a society that really values disordered eating. We talk about diets, we have magazines about this, we have online programs for this, even personal trainers talk about it. I'll even say, I called up a new gym the other day and the first thing they asked me about was, is my goal to lose weight? No, it's not. So we live in a society that values these things, and because of that, many people engage in disordered eating behavior. Even if it's not an eating disorder, they engage in these behaviors that are along the continuum, not in a good area. So many disordered eating behaviors are actually considered acceptable and they're celebrated. If, Aunt Sue loses 10 pounds at Christmas time, people are surrounding her saying, way to go, you look great, how'd you do it? And so because of that, if we look at this continuum of like healthy eating behaviors and eating disordered behaviors, so many people engage in disordered eating behaviors that I would not consider disordered eating rare. There are also eating disorders like orthorexia, which is not an official eating disorder in the DSM, but orthorexia is that more socially acceptable, health-focused type of eating disorder where people are very rigid in what they'll intake, but it's within that healthy, socially acceptable realm that I think a lot of people engage in that behavior that goes even beyond disordered eating into proper eating disorder behavior. But most people who behave that way wouldn't think that they were doing anything unacceptable or possibly unhealthy, because there's so many people around them celebrating that and encouraging it. Now, most people these days have maybe heard of anorexia nervosa, bulimia nervosa, another eating disorder within the DSM, which is for psychologists and therapists, the book that they go to for all the psychological information to really diagnose and categorize eating disorders and identify symptoms, is the other specified feeding and eating disorder, which becomes almost the catch-all for all eating disorder behaviors that clearly clinically concerning. However, they don't fit neatly into, anorexia nervosa, binge eating disorder, bulimia nervosa, but they still warrant treatment, and these people really need support. So in that way too, eating disorders are much more common than what you would think if you just thought about anorexia nervosa or bulimia nervosa, but it's not always neat and tidy. There are also many people who do not seek treatment. So while we are aware of a certain percentage of people who are in eating disorder treatment at this time, there are many people who are not seeking treatment. So when you think about how common eating disorders are, they're actually much more common than we can physically count. And for that reason, again, I would say that eating disorders are not as rare as we would think. Now, I just mentioned a little bit about orthorexia, and if you are interested in learning more about orthorexia and what that looks like, because it's not a DSM diagnosis at this time, leave a comment down below. Let me know what you'd like to know about it, and I'd really like to make a video on this in the future. Today we've covered some of the most common myths and misconceptions about eating disorders. To wrap up, I really want you to think, first off, question your thoughts. Where is this coming from? Is it because I'm really fearful and worried for my loved one or somebody that's in my life? Is it because I don't know much about eating disorders and I'm curious about it? Be aware of what you're thinking and, monitor yourself, especially before you make some of these statements to anybody else. I'd really encourage you to be humble about what you don't know and not to portray yourself as knowing more than you really do. And I'd like to encourage you, because watching this video is doing something. You're educating yourself about eating disorders so that you can become an ally. I really do believe that anyone who's watching this video is doing it because they care about somebody in their lives, or they're curious about eating disorders and want to be a support to other people. So thank you for watching, and I really hope that this is a helpful video for you. The take home that I would like you to take from this is to really recognize that eating disorders are not something that anybody with them would really like to have. If they could wave a magic wand and make it all go away, they would. So really take that to heart and know that, anything that you're thinking about what they're trying to do or what they should be doing, they're doing the very, very best that they can. And the best way that you can be a support is to, hold back the judgment, hold back these kind of misconceptions that you're having, and, be an ally and question and ask how you can help. Now, unfortunately, there are many more myths and misconceptions about eating disorders, and I'm wondering if there's any that you've heard of that I haven't included. If there are, leave a comment in the comment section down below. I'd love to make a video on these topics again in the future. I do have a plan to actually make a video on the myths and misconceptions that people with eating disorders actually have about their eating disorder, because, it's very complicated. So stay tuned for that in the future. If this video is helpful for you, give it a like. share it with a friend, and subscribe to the channel so we can make more videos like this. This is just the beginning of our eating disorder series on this channel, so stay tuned. We're going to be covering much more. Next week, we're going to be making a survival plan to help those with eating disorders prepare for the holiday seasons ahead. If you're interested in booking a session with one of our counselors, go to our website at parallelwellness.ca. In the top right-hand corner of the website, you'll see a button to book online, and you can book with one of our counselors in Burnaby or North Vancouver. We'd love to be social and be a source of positive and informative messages online. So don't forget to follow us on Instagram and Facebook, where we also share about upcoming workshops and events. Don't forget to check out our next video where we'll be making that survival plan to help those with eating disorders prepare for the holiday season. You're not going to want to miss it. See you in the next video.